DEVIDAS VADGAONKAR, practicing in Bandra East, Mumbai for last 30 years. When I come across a patient of polycystic ovarian syndrome, actually I feel very sad for the lady because this is the syndrome which disturbs the life of female from womb to tomb, you can say. Womb to tomb, you can say. The most common prevalent syndrome for the females in reproductive age and a later date also. It is generally because of disturbance in hormones leading to hyperestrogenemia, hyperandrogenemia, and causing lot of problems in the reproductive age earlier also and after also. Because of excess of estrogen and excess of androgen, the periods, generally she presents with irregular periods, then with some male features like mustache or beard and increase in the abdominal girth. Also, she comes for infertility. It is generally diagnosed clinically, like when the periods are irregular, it's less than say 8 per year, comes every second or third month, and then associated with can also be associated with alopecia, also can be associated with hair growth around lips and chin, and growth around umbilicus and lower abdomen, and then it is also associated, and when if it is untreated, it can lead to hyperestrogenemia and hyperandrogenism, leading to type 2 diabetes, hypertension, and these also can lead to fibroid uterus, endometriosis, which causes pain to the life of female, and the life becomes miserable. As the periods come every second month, third month, there is no regularization of the period. It is most of the time because of anovulation, and anovulation itself can lead to infertility. And then again because of overweight, she tries to withdraw herself, so all psychological problems also occur. She goes into depression, doesn't want to mix with anybody, tries to be alone in house, and then doesn't want to come out, mix with the people. That is the problem with these people. And because of anovulation, she can't conceive. Again, she has to hear a lot of things from the family that why we got married to her, you cannot give any child to our family, and I don't know what we can do to you. So all these things she has to listen. So it is, presentation is generally, most of the time these are obese patients, though lean PCO is also known, and these obese patients generally will come to you for obesity when the BMI is more than 25, that is the proportion of body weight with height, and above 25 is say obesity, overweight, and above 30-35 is a obese patient. And because they are obese, they cannot perform well, and then their activity is also less, and sometimes it is also associated with hypothyroidism. So all these patients will come to you with obesity, then irregularity of the period comes every second month, fourth month, fifth month. Then it is also sometimes associated with oligo, and then associated with infertility, inability to conceive. All these things lead to the life which is very depressive for them, and they cannot enjoy the life. So diagnosis is by few hormonal tests, like you do TSH, you do a ratio of FSH-LH, what is the ratio, whether it is increased, you will have to find out. Then you can do fasting insulin, you can do fasting blood sugar, then androstenedione we can do. Then most important test which I feel is you do SHBG, sex hormone binding globulin, and if it is less than particular period, then it is more diagnostic of PCOS. Then you do ultrasound. If the number of follicles is more than 12 to 24 and total volume of ovary is more than 10 cc, then you diagnose PCOS. Again, the ratio of ovarian cortex to medulla is also significant. So the diagnosis, as I told you, is most of the time it is clinical. Patient is obese, BMI is more, then history, periods are irregular. Then you can see the patient. That is you can see the mustaches, you can see the beard, and when you observe the abdomen lower down, linea nigra is there, then abdomen is protruding. These are clinically, and by ultrasound you all the features you can see. And diagnosis is again by blood test. You see more the fasting insulin is increased, fasting blood sugar is increased, because the body cannot accept insulin, so there is a hyperinsulinemia, and as the metabolism is disturbed, the blood sugar also has increased. So these are the criteria to diagnose PCOS. The management depends on the life modification, like you go for walk, you do exercise, try to reduce BMI, find out the diet which is reducing your fat. So go for more protein diet, less of fat and less of carbs diet. There are plenty of diets available. You consult a dietitian and try to find out what diet is suitable to you. Try to reduce your weight. Don't give a don't aim to reduce weight within 2 or 3 months. Like, it is very difficult to reduce a weight. Say patient is 90 kg and 100 kg, she cannot come to 70 kg in 2-3 months. So give her, see, in a month she has to reduce say 500 grams in a month. So give her that target and then she will be satisfied. But if you give her a target that jaldi karo, the weight kamti karo, she is not going to go do that, and then her frustration will increase, her depression will increase, and it can never be improved. There are few herbal products also available, Herbalife, etc., but I don't have any experience with that. But life modification and then activities and control on the diet, there are few drugs available which can be tried, like metformin is there, myoinositol is there. Under doctor's guidance, you can try these drugs. Also, there are combination of myoinositol and metformin. You can try those drugs. If there are androgenic effects like mustache, etc., then you can try anti-androgenic drug, as well as she can go for some removal of hair, etc. She can consult some cosmetologist and get rid of them. And coming to the treatment further, if try to reduce the ovarian volume by adjusting the dose of all drugs, and if it is not coming under control and patient wants to conceive, then you can think of doing laparoscopy and puncture of the ovary to reduce. But see to it that when you do puncture, it should not be more than 4 to 5, because it should not decrease the ovarian size and decrease the AMH level. So, follow the rule, do the punctures meticulously, and we should try to conceive the patient within next 3 to 4 months. This is about reproductive age. After reproductive age also, this gives lot of problem, lot of irregularity in the menses, and is also associated sometimes with lot of fibroids, fibroid uterus and endometriosis. Later period also it is associated with dysmenorrhea, dyspareunia, and AUB also it is associated. Sometimes it leads to excessive bleeding. So try to find out along with fibroid whether there are any polyps in the uterus. Try to remove the polyps, and if the symptoms are more, you will have to think of removing fibroids which are disturbing her, and if endometriosis is deep, you will have to think of doing surgery for endometriosis. If untreated and if the hyperestrogenism continues, there is a likelihood of she going for CA endometrium. So keep watch on PCOS patient whether they are going for endometrial cancer and treat them accordingly. Now, about that, as I told you, exercise is more important. Calculate the number of calories which patient is consuming and try to reduce the number of calories. She should eat less of fat and less of carbs, and go for more of salad, more of soups, then more of fruits which will not give her more glycemic index. Try to eat the product which has got less of glycemic index. Try to avoid all forms of fat. Say, ask her to eat chapatis without ghee and use less of ghee in her diet. Then these people are very fond of cheese and butter. So you have to warn them that they should not eat cheese or butter, which is very deterrent to their health. And about carbs also, they have to control carbs, eat more of protein, eat more of salads, and all junk food they have to avoid. So ask them not to eat junk. Yes, as I told you, try to not to have all junk food like burgers and then all McDonald's products or all sandwiches which are very heavy, full of mayonnaise. Try to avoid that. Try to have simple life and try to reduce the incidence of PCOS. Have a healthy life, healthy society and healthy nation. Thanks.